everyone. I'm Kibin Alleyne, and today is Tuesday, April 30th. You're now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. April is National Donate Life Month, a time to recognize and honor those who have saved lives through organ donations. In New York City alone, almost 8,000 people currently wait for these life-saving donations. Dr. Milan Kinkhabwala, Chief of the Division of Transplantation and Director of Abdominal Transplantation at Montefiore Health System, joined me to discuss the critical importance of these donations. Doctor, thank you so much for joining me. Now, can you tell me more about Montefiore's history with organ donation?
Sure. So we've been a proud member of the community in the Bronx since 1967. So we were actually one of the first transplant centers in the world to perform transplants, and we've been continuously performing transplants since then. So more than 4 decades now, we've been involved in both kidney transplant as well as liver transplant, and we now have a heart and lung transplant program as well. So very comprehensive set of operations that we perform for the community.
Thank you. And I know you mentioned a few of them. Can you just quickly tell us? I mentioned just organ donations, but I understand there's a little bit more to that. So can you just clarify that for me?
Yeah, so there's two types of organ donation. So when we perform transplants, solid organ transplants like kidney, for example, those organs can come from two sources. One could be deceased donors, which are people in the community, hospitals that may pass, usually because of a neurologic problem like a stroke or trauma, and then they or their family members consent to organ donation. That's the most common way transplants are performed. But there's also living donation, which is particularly important for kidney donors, for kidney recipients. About half of the kidney transplants performed in the US are actually from living donors, where a friend, family member, or even someone unrelated may come forward and offer to donate their organ for someone in need on the waiting list. So these two types of organ donation are the way that transplants are performed in the United States. And it's available here in our center. We've been doing living donors now for, again, 30, 40 years. So it's an important component of our practice. And we have been very active in promoting deceased donation in the community as well to increase awareness around being an organ donor for both community centers as well as for patients who come in the hospital.
Now, can you talk about National Donate Life Month and the impact it's had on the healthcare industry?
Well, it's wonderful that we have this Donate Life Month because there's such a need nationally, especially in New York and also in the Bronx, for people that are waiting for organ transplants that have been waiting a long time and have a significant need to obtain an organ before they get too sick. So having this Donate Life Month, which has been going on a long time, it's a National Donate Life Month to raise awareness in the United States around the need for organ donation so that people in the community may come forward and potentially sign their donor card or sign on online on the registry so that they can be organ donors.
Now, I want to highlight the importance of donating. I know for a lot of people, just the idea of it can be scary, or a lot of people just don't know that much about it. Can you just explain a little bit more about, just the overall importance of this act?
Yeah, so this is a selfless act. When you're a deceased donor, you are offering a part of yourself to help restore life in someone that you may not know. So I think this is an act of altruism, generosity, and selflessness. There's no barrier from a religious standpoint or from a medical standpoint to donating organs or tissues. This has been clarified by all the churches, synagogues, and other religious leaders in the community as being important to participate in if you're a citizen or a member of the community. So I think that it's an act of generosity. You're helping save another life, and I think there's a lot of interest in this, and we're trying to make it easier for people to register to donate so that there's no obstacle in their mind that if they do pass, then both they've declared themselves as potential donors and they've also told their families that they want to be an organ donor so that if it does happen, God forbid, that they're able to actually turn that tragedy into something very positive by being able to help someone else in need.
Now, there are almost 8,000 New Yorkers who need a life saving organ transplant. Just off the top of my head, thinking about all of the health disparities that we have here in the Bronx and, across New York, can you just highlight the extreme need for organ donations in New York City?
Yeah, so New York and the Bronx in particular are communities where there's a lot of patients that have different diseases that lead to organ failure. So diabetes, for example, is very prevalent in our community. Hypertension is prevalent in our community. This leads to all kinds of conditions like cardiac disease, kidney disease, liver disease, and these are the things that ultimately, in some patients, lead to organ failure where they need an organ transplant. So, because there's a lot of prevalence of some of these underlying conditions in our community, we have a higher rate of patients that are waiting for organ transplants in New York, say, compared to some other parts of the country where the population may be generally, maybe potentially healthier. So, because of that situation, we have a dire need in New York for organ donors because we have a lot of patients on the list. As you mentioned, 8,000. There's close to 100,000 nationally. So, we have a huge gap in the availability of organs, but particularly in our community, where we're trying to get the Bronx community to be aware of this particular need with neighbors in our own community that really would benefit from having community support through organ donation, so we can address some of the disparities that we know exist in organ transplantation, like it does in every aspect of healthcare.
Now, what are the most common life saving organ donations? And with that, are there any challenges in regard to that?
Yes, so the most common type of organ donation, as I mentioned, is deceased donors. So what happens in a deceased donor donation is that a patient will come to the hospital, um, and as I mentioned, usually the condition is a neurologic condition like a stroke, but it could be a trauma, for example, that results in a condition called brain death. So brain death is a particular medical condition, and it's legal as well as medically approved where the brain is no longer viable. That means the soul has passed, and the brain is no longer alive, but the heart is still alive because through our life support mechanisms, we're able to continue to provide life support to keep the organs functioning, even though the patient's brain is passed. So in that situation, we're able to remove the organs if the patient consented or if the family consents. And that's a surgical procedure we do in the hospital. So if a patient passes and they're declared brain dead by their doctors, then we would take the patient to the operating room in order to remove the organs that they consented for. And it doesn't always have to be organs. It can also be tissue like skin, corneas, which are used for eyes, um, cartilage, and valves, which are used for heart patients. So it's not only organs per se, it could also be other types of tissues that are donated.
Now, what are some common misconceptions about this entire just donation, like organ donation in general?
Oh, there's a lot of misconceptions. Just because it's a very mysterious process for most people, how do you take an organ out of someone and put it in someone else? But we're trying to demystify it, and I think it's very important to gain the trust of the public that the organ transplant community is separate from the team of doctors that are taking care of any individual patient in the hospital. So we're not involved in making decisions about whether someone is declared brain dead or not. That's their patient's own doctor. And if the patient is declared brain dead, only then do we get involved as an organ transplant community to try and help the family obtain some resolution of their grief by potentially donating. So I think there's a lot of misconception around the idea that somehow by being an organ donor, the patient would not be treated the same way as someone who's not an organ donor because we're trying to obtain their organs, for example, before they're actually dead. That never happens. So we only wait until the patients are declared dead by their own doctors, and if the patients have consented, then only then would we be eligible to go in and potentially use some of those organs for our transplant patients.
Now, this is really important, so I wanted to highlight it. One organ donor can save up to 8 lives, which, when you put it in that perspective,
Yeah,
it's very, it's just a lot to, take in that like
yeah,
one
it's
person
dramatic,
could save so many people. So,
right?
can you just expand on that a little bit more?
Yeah, so when you donate an organ, it's not only one organ. So depending on the health of the donor, donors can donate a heart, two lungs, two kidneys, a liver, as well as tissue such as I mentioned, skin, corneas, valves. So you're talking about a lot of potential patients that can be impacted, people that are waiting by a single organ donor. And that's why it's so important for people to understand that by being an organ donor, you're really impacting a large group of people. And if you pay it forward, you can imagine the amount of people that are positively affected by being an organ donor. You could save somebody's life, but in turn take that person's life that you saved and help their family. So it really has a magnifying effect in terms of helping the community when you donate.
Now, what are the steps needed for organ donation, and who would be a right fit for organ donation?
Well, right now, I think anybody that is either wants to be a live donor, they can certainly approach any of the transplant centers in New York. And they have programs in which live donors that may want to donate to somebody, either they know or they don't know, can be carefully screened and undergo an education process if they want to proceed with being a living donor. And this would be primarily for kidney or also liver transplants. But for deceased donors, the most important thing is that everyone in the community should declare themselves as willing to be a living donor, either through their driver's license. But if they don't have a driver's license, it's not a requirement. You can go online and register at donatelife.org, where you can register to be an organ donor on the National Organ Donor Registry. And this will be recorded so that if it ever comes to pass that you do become a donor, then we know what your wishes are, and then the teams can can move forward appropriately.
Well, Doctor, I want to thank you so much. I think this is an important conversation to have. As you mentioned, there is a lot of mystery around this, especially in communities like the Bronx, where a lot of people have a lot of mistrust when it comes to
Yes,
certain procedures. So I think it's so important that we were able to have this discussion and kind of talk about it, and as you mentioned,
yeah,
demystify, the
yes,
act of organ donations. So thank you so
yes.
much.
Thank you for having me. Thank you.
To learn more about the Montefiore Einstein Center for Transplantation, please go to the website on the screen below. Don't go away, we'll be back with more Open after this.